Hello, and thank you all for joining us today at UPMC Southside. I thank those that are here in person and those that are attending virtually. I also want to thank the people who are following the masking and infection prevention protocols observed here and at all UPMC facilities. This is still an important action. I'm Dr. Don Yealy. I'm the Chief Medical Officer for UPMC. I'm pleased today that we have Pennsylvania's Acting Physician General, Dr. Denise Johnson, and the Director of the Allegheny County Health Department, Dr. Deborah Bogan, joining us here to discuss the many tools that we have, in addition to masking and distance, to keep you healthy and protect you against COVID-19 infections or complications of those infections. Those techniques and tools are available all across UPMC, but they're all available under one roof here at UPMC Southside. In our UPMC COVID-19 specimen collection clinic, we safely and conveniently collect nasal swabs from people who might have COVID-19. We stood this capability up in a matter of days in March 2020. Many of you joined me here when we first showcased that. We initially used a test that was developed at UPMC that allowed us to quickly respond to the need for testing in our communities. Since the beginning of the pandemic, we have tested over 665,000 people for COVID-19. Testing has always been important to keep us safe during the pandemic, and it remains important even today in better times. If you are symptomatic, if you think at all that you might have COVID-19, don't assume that it's not COVID-19 because you've been vaccinated or because the illness is less common. Us knowing and you knowing if you have the virus is continuing to be one of the key first steps in helping to contain spread and to help us treat you in a way that thwarts serious complications from the illness. This location is also one of our many sites that allows COVID-19 vaccination clinics to occur. This was one of the first clinics in the Commonwealth to vaccinate people. It happens outside of the hospital, and we continue to use this site today. Across all of our UPMC sites, we've given out approximately 600,000 doses of the COVID-19 vaccine. At this UPMC Southside location, we have rooms with sensory equipment for people with autism or other special needs. We have language translation services to make sure that everyone understands what's happening and is comfortable with the procedure and the processes. This allows them to focus on their health care. Finally, the UPMC Southside Center is another one of our sites that offers monoclonal antibody therapy in a dedicated infusion center. Monoclonal antibody therapy is a one-time treatment that, when given shortly after your infection, it dramatically lowers the need for hospitalization and the risk of dying. So far, UPMC has given over 3,000 doses of monoclonal antibodies at 46 different locations across Pennsylvania, New York, and Maryland. We've done more than any other provider in the Commonwealth. I'm now pleased to introduce my colleague, and UPMC infectious disease pharmacist, Dr. Erin McCreary, who will tell you more about monoclonal antibody treatments.
Thank you, Dr. Yealy. It is amazing that we have multiple highly effective COVID-19 vaccines, as well as monoclonal antibody treatment to prevent a strong likelihood of preventing newly infected people from becoming very, very sick. So antibodies are proteins that your body produces in response to an infection or a vaccine. If you get vaccinated, it can take days or even weeks for your body to make enough of these antibodies to keep you from becoming very sick from infection. And that is why we still have to wear our masks even for a few weeks after we're fully vaccinated. If you're infected with a virus, these antibodies help by attacking the virus, and it basically blocks that virus from entering your cells, and it tags it for your body to safely eliminate it, again, preventing you from becoming very sick. So monoclonal antibody treatment is simply a perfected version of our natural antibodies that we produce in response to infection. Mono means one, and clonal means copy. So what this treatment is perfect copies of a highly effective antibody against COVID-19. By giving monoclonal antibody treatment early in the infection, as Dr. Yealy mentioned, we give your immune system a leg up on the virus before it can take hold and do very severe damage. That's why monoclonal antibody treatment must be given as soon as possible after the infection, within 10 days of the onset of symptoms. Preferably, we would like patients to receive these within 4 days of the onset of symptoms, as that's what our data show is the most effective. Right now, there are 2 approved monoclonal antibody treatments in the United States that are available for patients, and we offer both at UPMC. There is a 3rd monoclonal antibody treatment that was just approved, but the drug is not yet available. However, our teams are working earnestly, and we are ready to go to administer that to patients as soon as it becomes available. All of these treatments are a one-time intravenous infusion, which means through your vein, and they're given in 30 minutes or less. As Dr. Yealy said, we currently offer this at 46 comfortable and welcoming locations across the UPMC health system and all of the communities that we serve. Monoclonal antibodies are offered in dedicated infusion centers like the one here at UPMC Southside, and they're also offered in all of our emergency departments so that we can treat patients as soon as they arrive to healthcare and as soon as they're identified as possibly benefiting from this treatment. We also bring monoclonal antibody therapy directly to patients' homes, to patients that are in behavioral health centers, or to patients that are in long-term care facilities. Basically, we'll bring the treatment to you if you are unable to access treatment. So if you think you have COVID-19, you should ask your doctor about whether or not you should be tested, and you should get tested as soon as possible if it is recommended. If that test turns positive, you should inquire about monoclonal antibody therapy. If your doctor is unfamiliar with this therapy, or if you don't have a primary care doctor, you can call us yourself and get in touch with our friends at UPMC by calling 1-866-804-5251, or you can visit upmc.com/antibody treatment. But best of all, you can avoid getting COVID-19 by getting vaccinated. And with that, I have the pleasure of introducing Dr. Denise Johnson, the Acting Physician General for Pennsylvania.
Well, thank you very much, Dr. McCreary and Dr. Yealy. As you heard, I'm the Acting Physician General for the state of Pennsylvania, and I'm excited to be here at UPMC Southside. And I'm here today to learn more about what's happening with the successes of the monoclonal antibody treatment, also about the UPMC and Allegheny County Health Department vaccination efforts for COVID-19, and an update on the Pennsylvania Department of Health's vaccination and equity efforts, but also to answer your questions so that you can have the information that you need to get vaccinated. First of all, I want to give a heartfelt thank you to those of you who have been vaccinated. Being vaccinated, you've got the best protection against COVID-19. But not only that, you protect yourself from hospitalization, and that in turn increases the capacity of our healthcare facilities and organizations to be able to care for those acutely ill people who are having heart attacks and strokes, and by expanding their capacity. You also are not only protecting yourself and your loved ones, but you're also protecting others in the community. You're protecting those who are not able to be vaccinated yet, especially children, and you're protecting those who are not able to be vaccinated because of an underlying health condition. You also are helping to get us back to doing the things that we missed doing over the past year, and you're proving that together we have the power to end COVID-19. As you heard, we're making tremendous progress in our battle against COVID-19. You've heard from Dr. McCreary and from Dr. Yealy that the monoclonal antibody treatments that are being used can help prevent patients from being hospitalized and dying from COVID-19. They are necessary to be treated immediately once you have the symptoms, once you develop COVID, because that's your best protection and the best outcome from those treatments. We also have treatments available for hospitalized patients with COVID-19, but they are not over-the-counter treatments for COVID-19. You heard what the treatments are for hospitalized and non-hospitalized patients. But while these treatments are available and have great success in treating COVID-19, we have 3 vaccines that are available, that are safe, and that are effective, and that give you the best protection against COVID-19. The Department of Health is giving a high priority to making sure that all Pennsylvanians, especially now that all Pennsylvanians over age 12 are eligible to be vaccinated, we want to make sure that all Pennsylvanians have access to the vaccines. And this entails a lot of the measures that you've heard that are happening here. Transportation for people who have difficulty getting to vaccination sites is important, but also making sure that we provide information in multiple languages so people are able to understand that vaccine information. We also want to make sure that vaccine is available to as many providers throughout the Commonwealth so access is easier for people to get to. And then also we are collecting race and ethnicity data to make sure that we are getting vaccines to people in an equitable way throughout the Commonwealth. We have a dashboard, the COVID-19 dashboard, that is on our website that has some of that race and ethnicity data. You can find it at health.pa.gov. And by monitoring how we're doing with race and ethnicity, we can work with providers to make sure that we are getting vaccine to the different areas of the community, especially areas where there are lower vaccination rates or in some minority communities that have difficulty accessing the vaccine. And we are doing things like this clinic here, and many clinics that have been happening throughout the Commonwealth in different locations. They're happening at hospitals, but also in provider offices. They're happening in pediatrician offices. We're also been at schools and churches and mosques and any place where people can gather to make sure that they have closer access to vaccine. But we're also working on providing good information. We have a media campaign. Many of you have seen it on TV, on radio, on billboards, to make sure that people have the information that they need to make that decision to be vaccinated. We have weekly newsletters that go out. You can sign up for a newsletter with your email at pa.gov/COVID. We have information in Spanish and English, but you can also access our website in dozens of different languages as well. Now that everyone over 12 in Pennsylvania is eligible to be vaccinated, we want to make sure that questions are answered so that people can make that decision. Questions like, how much does the vaccine cost? We want to make sure that everyone knows that the vaccine is completely free of cost to the individual accessing that vaccine. You may be asked for an insurance card, but whether or not you're insured or don't have insurance, you still can get the vaccine with no out-of-pocket costs. So if you're asked for your insurance card, you can say, no, I do not have one, but you still get the vaccine for free. And so while we're working on these efforts, it's important that I get out to communities like this and make sure that there's an opportunity to answer questions that people may have and tell my story and why I decided to get vaccinated. As soon as the vaccine was available to me, I got vaccinated, and I vaccinated my colleagues, and I vaccinated hundreds of people within my community because I knew that this would be the best protection for me against COVID, but also for my loved ones, also for my friends, for my patients, for my coworkers, for my community. It also helped me to get back to the things that I was used to doing and that I enjoyed doing without worrying about developing COVID and certainly worried about passing it on to someone else. And so this is something that you all can do. If you've been vaccinated, you can help. by telling others why you were vaccinated and answering questions or leading them to a source of good information so that they could make the good decision to be vaccinated. Together, we are making an impact, and we have the power to end COVID-19 by being vaccinated and helping others to make that decision as well. And now I'm happy to pass it on to Dr. Deborah Bogan.
Thank you, Dr. Johnson. So ever since the first COVID vaccines were approved for use in the United States, the Health Department has been working diligently to help every eligible resident of Allegheny County get vaccinated. Those efforts continue today. Why? Because these vaccines really work. They're really what we need to overcome this virus. Looking back at our county-wide vaccination efforts since late December, one constant is that as needs changed, so did we. At the start, for example, we focused on our most at-risk population, seniors. We set up clinics at senior centers, long-term care facilities, senior living facilities. And today, we can report that nearly 100% of people 65 and older in Allegheny County are at least partially vaccinated. As vaccine supply increased and more people were vaccine eligible, the Health Department and many other vaccine providers, including, of course, our regional healthcare providers, opened mass vaccination sites for people wanting to get vaccinated, people who did not need to be convinced. For many weeks, our community administered more than 10,000 doses a day, many at large sites. Eventually, of course, supply began to exceed demand, and large-scale sites no longer made sense. So we adjusted again. We moved resources to smaller settings and events and increased our outreach to homebound and populations who would benefit from outreach, including people who were understandably more unsure about the vaccines. Overall, we, and when I say we, I mean all those who helped vaccination efforts here, have done well in Allegheny County. 76% of all adults have now been at least partially vaccinated, and rates are also improving quickly among our eligible youth populations. But our work is not done. We can reach more people on their terms, and to do so, we're adjusting again and getting creative. For example, we recently launched the work we supported with Your Mom's House Productions to develop videos sharing stories of resilience and hope in our communities of color. And these stories can be viewed at covictories.org. We are partnering with the Pittsburgh Zoo and PPG Aquarium to provide free vaccines and free admission to anyone who gets vaccinated outside the zoo this Saturday, June 19th. We're also partnering with East End Brewing Company for Shot and a Beer Night on June 24th at the Larimer Brewery, during which anyone who gets vaccinated outside can have a free beer inside. But remember, while it's great to get a free trip to the zoo or a free Big Hop or Gratitude, those are names of East End Brewery beers, the ultimate reward for getting vaccinated is protection and a return to normalcy. In the county, more than 1.3 million doses of vaccine have been given. Nationally, more than 300 million doses have been given. The safety of the vaccines is well established, and vaccines are highly effective at preventing COVID. So please, everyone, go get vaccinated. Thank you for being here. Be safe and be kind.
And now we'll take questions from the media here at UPMC Southside and those joining us remotely online. If you're here in person, please state your name and outlet before asking a question and direct your question to one of the speakers. For participants online, you will have to use the raise hand feature and you'll be put into the queue. I'll read your name and your line will be unmuted for you to ask your question, or I will call on you here in person. And we'll try to call on as many different media outlets as we can with the time allotted. So for the first one, we'll take one here in person.
Dr. Johnson. Oh, sorry. Over here, sorry. No problem. Aaron Martin with WPXITV. This is for Dr. Johnson as well. I just wanted to get an idea at this point where things stand for hitting 70% of adults in Pennsylvania getting vaccinated. If it looks like that 70% number will be hit prior to the June 28th date of the mask mandate being lifted?
Sure. Well, that all depends on the Pennsylvanians getting vaccinated. We know that it's been a little while, a couple weeks, so that we've gotten to 72, I believe, maybe we're close to 73% of Pennsylvanian adults who have gotten their first dose of vaccine. So we know that that means that it's a few weeks after that they get their second doses, and then we should be at that 70% mark. It really depends on Pennsylvanians continuing at the rate that we've had to get that vaccination done. And I believe we still can make it, but we still need to continue at the pace that we're going.
Are there any concerns that people won't get their second doses? Because I know that's been happening a little bit in different parts of the Commonwealth.
We haven't really seen that at any great numbers. It really looks like the people who have gotten their first doses have the message that getting both doses gives you the best protection, and the protection drops off significantly if you've only had one dose. So we've had that message out there, and we have seen that our clinics are reporting people are coming back for their second doses.
Thank you.
Okay, next we have Scott Beveridge online from the Observer Reporter.
I'm sorry. Thank you, but the question I had was already asked.
Oh, okay. Well, then we will move on to Nicole Ford, who is also online.
Hello. I just had a question. Since Pennsylvania did hit the goal that Biden set for July 4th with at least one dose, kind of what's next for us in Pennsylvania? Are we going to change the way we're pushing vaccines, or is life kind of going to return to normal? I know a lot of people are wondering, is COVID going to be a long-term problem?
Well, thank you. So we do have the goal of 70% of Pennsylvanians getting both doses of the vaccine to lift the mitigation orders, or by June 28th, as was stated. But we want to make sure that every eligible Pennsylvanian gets vaccinated. We know that there are some areas where the vaccination rates are lower than that overall Pennsylvania number. And we know that there are communities that have more difficult access to vaccine. So we are not going to be stopping vaccination when we hit that number. We want to get as many Pennsylvanians protected as we can. We continue to have cases that are in the hospital. We still have people that are sick. So we want to make sure that we decrease the virus that's circulating and continue to vaccinate until we can end COVID-19.
Thank you. And we'll take our next question here in the room.
Hi, I'm Jamie Martinez from Spotlight, PA. My question is actually for Dr. Bogan. Hi, I'm back here. You mentioned earlier that there were some challenges to implementing the data and making sure that vaccines are getting to parts of the county that need it. Can you talk a little bit about what those challenges are and what the county's doing to, I guess, get around them?
Yeah, we continue to, the state has the data for from CIS, the state immunization information system, and we get de-identified data from the state, but we're running into some challenges around analyzing some of those data to be able to really implement targeted information about where vaccines are needed the most. So we're working with the state on identifying those challenges and overcoming those limitations of the data we receive from the state.
And if I could just follow up, thank you. Is it a question of like zip code where people live versus where they're getting the vaccine, or I guess what is the problem with it?
It has to do with, probably best if I answer that question offline, and it's quite technical on some of the limitations of the data, yeah.
Thank you.
Thank you. Up next, we have Paul Go online from the Pittsburgh Business Times.
Hi, thanks for taking my question. I was wondering, what have you seen in terms of the people who have been hospitalized lately for COVID-19? I think this would probably be for Dr. Yealy. Thanks. Are they mostly unvaccinated? Are there breakthrough infections? What's sort of the scope of how people are getting, and also how people are getting serious COVID at this moment?
Thank you very much for the question. I think it's an excellent question. And restating it is, what are we seeing now with people who either seek hospital care or require hospital care? The vast majority of people who are admitted to a UPMC facility with a COVID-19 infection have not been vaccinated fully yet. So that means they either haven't started or haven't completed a vaccination series. There are occasionally people who have completed their vaccination series who come to the hospital. We knew that would happen. It doesn't mean it's a failure of vaccines in general. That can happen for a lot of different reasons. Most of those people have another underlying condition that makes it understandable why, and they still do better than what we were seeing before. So the message is the vaccinations work, they're safe, and they provide excellent protection, not perfect protection, but excellent protection, something different than what we've seen with virtually every other type of vaccination. It's not a reason to not get vaccinated. These things really will help keep you and your family safe.
Thank you. And we'll take our next question here in the room.
Hi, Sean Hamill at the Pittsburgh Post-Gazette. I have a question for Dr. Johnson. Can you tell me what you think about healthcare facilities, hospitals, but also senior care facilities requiring vaccination of their staff? You know the numbers for senior care. We don't know for hospitals generally, but senior care facilities in the state were very low in the first survey that they did of senior care facilities. Do you think hospitals and senior care facilities should be requiring vaccination at this point, especially given everything that has been said about how safe these are, how effective they are?
Well, the ultimate decision about requiring that will come from the organization. So at this point, that's not coming from the state. But I believe that any organization that is caring for vulnerable people have an interest to make sure that their staff are vaccinated. I know that organizations are strongly encouraging their staff to be vaccinated because when you're caring for a vulnerable population, the last thing that you want is to have any sort of be able to spread a dangerous virus to your vulnerable population. So it's not a decision, it's not a mandate that is coming from the state, but we certainly encourage facilities to look at the best interests of the people that they serve in terms of making decisions for that organization.
Thank you. And I had a related follow-up for Dr. Yealy. Dr. Yealy, can you tell us what UPMC's policy is currently? If you aren't requiring vaccinations, why aren't you requiring? And what can you tell us about the percentage of your staff, system-wide or here in Southwest PA, if you know those numbers, that are vaccinated? And have you had trouble getting the vaccination rates that you would like among your staff?
So you asked a couple of questions there. First and foremost, UPMC does not currently have a requirement for all employees or staff to be vaccinated. What we have is an aggressive educational and convenience availability approach to getting people vaccinated. Right now, about 75% of people who are eligible for the vaccine working at UPMC have had the vaccination. What we think is more important to focus on, the point of the vaccination is how can we take care of both our patients and our healthcare workforce in the best way? How can we keep you safe? And to date, vaccination is an important part of that. It's not the only part of it. And we've seen excellent outcomes in safety for both patients and staff members. We think the current approach to education, dialogue about what the benefits are, and making the vaccine more and more available will help us achieve even higher rates. We have higher rates of immunization than many of the other healthcare systems around the Commonwealth, around the country, and we will stay close to see what not only the governmental advice on this is, but what the national and the local data are, and we'll always consider those other options. But right now, we think that we're able to provide, and our data show we're providing safe and effective care with our current approach to this.
Does UPMC currently require any vaccinations of your staff that are non-COVID related? And in the future, based on what you said earlier, are you contemplating requiring COVID vaccination?
The only vaccines that are required right now are the seasonal influenza vaccination. That's been in place for many years right now, and if you think about it, we had 30 years of experience with influenza, not only the vaccines, but what it causes in both healthcare workers and in patients. There are no other vaccines that are required, and we continuously look at the data that are available not only in the vaccines, but on the safety of our patients and our healthcare workers, and we monitor both the governmental activity and what other healthcare systems are. I'm sure you've been aware in the papers there have been lots of articles on both sides of this issue. It's a pretty contentious point right now.
That's why I asked the question.
Yeah, we think the way to successfully manage this is to have a multi-pronged approach and have an ongoing conversation with our important partners, which are those that are providing healthcare under the UPMC umbrella.
Thank you.
Thank you. And our last question is going to be from Nicole Ford at KDKA Online.
Hello, I had a follow-up, I think, for Dr. Johnson. What's it going to take for us to officially say we're at the end of this pandemic?
Well, the decision that we're at the end of the pandemic would come from the World Health Organization that declared the pandemic in the first place. So that's where that declaration will come from. Right now, again, remember that we still have COVID-19 circulating. People are still being hospitalized. People are still dying from COVID. We still have hundreds of patients in the hospitals in Pennsylvania right now with COVID-19, and we continue to have deaths every day. So for all intents and purposes, here in Pennsylvania, the COVID-19 pandemic is not over, but that won't be declared by us. It would be declared by the World Health Organization. Thank you.
Thank you. And that concludes the time we have allotted today. A press release did go out on this topic from the Pennsylvania Department of Health. We want to thank you all for attending. In about 45 minutes, we'll email the media attendees a link to download high-definition footage and photos of this entire press briefing and the tours that Dr. Johnson and Bogan took of the UPMC Southside Testing, Infusion, and Vaccination Clinic, which we encourage you to use in your news reports. Reporters with follow-up questions are encouraged to contact the Pennsylvania Department of Health Press Office at ra-dh pressoffice@pa.gov or UPMC Media Relations Department at upmc.com/media. Thank you.